Good morning, everyone, and thank you for joining us today. My name is Mike Oates, and I'm the President and CEO of Hudson Valley Economic Development Corporation. And I'm very excited to have our good friend, Senator Gillibrand, with us today to discuss COVID-19, the CARE Act, and future help from Congress to tackle the many challenges facing our country and our region. Let me take a moment to explain how we're going to run this video discussion. The Senator will open up with her remarks, and then we'll take as many questions as we can. HVDC will work with the Senator's staff to get answers to all of your questions, even the ones we won't have time to answer today. I also like to thank the Senator's staff, especially Lisa, who has worked closely with us to provide the latest information to the business community during this crisis. Senator, we have many businesses, nonprofit, and community leaders on the call today, all eager to hear from you. So with that, Senator, thank you again for your time, and I'll turn it over to you.
Well, thank you all for joining me. I know this is a very difficult time for all New Yorkers and frankly, our whole country. And I know that the strain and stress of COVID-19 has been intense. People are isolated, anxious, fearful. Some people are sick. Some people have lost loved ones. And so it is a tough time. But one of the things that I know about New York is that we are resilient and we are strong.
Grace, my headphones are somewhere. You can get them.
Someone's not on mute. So I know that these are tough times, so we have to just come together. And as business leaders, you are often the pillars of our communities, and you often can provide guidance and strength for our neighbors and our family members in a way that can make a difference. One of the reasons why I was really grateful and appreciative of this opportunity to talk to you all was just to give you some guidance and some information about what's happening on the federal level and what we're trying to do to make people be able to really survive this time. So far we've passed 3.5 bills. We call it COVID 1, 2, 3.3, and 3.5. 3.5, the one we just passed this week, is intended to top off COVID 3, because COVID 3, while well-intentioned and while basically a triage bill going to the most urgent crises, it wasn't enough money at all to meet the needs of any of our frontline workers or constituents. So for example, COVID 3, we made our first priority healthcare and the well-being of our constituents. So we sent $150 billion to hospitals across the country. That was a general formula based on Medicare. And so all hospitals got some money, but not necessarily to greatest need. So that was a huge problem because New York is deluged right now and a lot of our hospitals are on the brink. So we needed to make sure that this next bill, which we just passed, was targeted towards hot zones. And New York is certainly a hot zone. So, and Westchester in particular. So we should be getting more money. This package we just passed was $75 billion more for hospitals. Second, we wanted to focus on people who had lost their jobs. So we sent out unemployment insurance for anyone who could file effectively, which is hard because the Department of Labor websites keep crashing and sometimes people can't get through for weeks. So we tried to get money immediately to the unemployed for 4 months. And so that was a first step. Third, we wanted to help our small businesses. So the small business tranche of the first bill was absolutely consumed almost within a week. So we wanted to top that up. We put another, I think, $350 billion into that fund in this bill this last week. We tried to carve out money specifically for businesses and communities that didn't get access the first go. We know that if you had a relationship with a major bank that did SBA loans and you were a big client of that bank, you got your loan immediately. If you weren't, if you were underbanked or had not had a relationship with a bank that had SBA loans, it was really hard to get money in that first tranche. So we carved out $60 billion specifically for rural communities, businesses in at-risk, at-need regions, communities of color, women-owned businesses. These were places that didn't actually get access because they didn't have the right relationship with the right banker quick enough. So money went for that. We also put a little bit of money in for testing. One of the biggest problems we have right now to opening back up is getting our testing up and running. So we put $25 billion in to start testing around the country, create a supply chain for testing, because as you know, our testing centers have run out of swabs, they've run out of reagent, and some hospitals can only have the capacity because of the supplies to do like 100 or 200 tests a day. Nationwide, we need to be doing 1 million tests a day. And so it's really important that we create this pipeline of testing materials. So we put 25 billion towards that. So that's what we did. It's not nearly enough. We also in COVID-3 put $150 billion into the states and local governments. Obviously, New York cannot fill its gaps in its budget because it has no revenues. No city can, no county can. And so we started giving money with 150 billion. We tried to do another 150 billion, but Mitch McConnell blocked it. And so without Republicans in the Senate willing to help cities and states, we kind of couldn't go any further. So hopefully in COVID-4, we'll be able to re-up the money for cities and states so they can get closer to closing their budget gaps. But I think this shutdown is going to last longer than people imagine, and it's going to hurt businesses, communities, individuals harder than people can imagine. And so we just have to keep working towards getting the resources we need as quickly as possible. One other piece of legislation that I'm hoping to include in the next bill is money specifically to train a workforce to do the testing. I want to have a National Public Service Corps, particularly a health force, to do this work, to do the testing, to do the contact tracing, and eventually to do the vaccinations. And so that health corps is a bill that I've introduced with other senators that we're hoping gets included in the next package to begin to do the testing. Once we have testing, and if you really do have universal testing, you can test every kid before they go back to school. You can test any kid that gets a fever. That will make all the difference, because we know schools could be vectors of the virus. Kids can be super spreaders. Thank God they don't get as many symptoms or as harshly as others. They've largely been protected during this pandemic, but we don't want to reopen schools before we know we can stop the spread. So that's where we are. I've been spending a lot of time talking to our stakeholders around the state, our hospitals, our first responders, our homeless shelters, our food banks, domestic violence shelters, and everyone is in great need. So I look forward to this call, and I hope if any of you have ideas or need direct help, you'll reach out to my staff. Lisa Hoflick is on the call. She is my Westchester regional rep. She'll introduce herself later. So you know, if you need any help at all, if you have family members still trying to get back to the United States, if you have difficulty getting your SBA applications in, if you have difficulty getting unemployment benefits, again, our staff serves you. So we are here to help. Thank you, Mike. Turning it over to you.
Okay, thank you, Senator. That was great. We have a ton of questions that have come in, and we're going to try to answer as many as we possibly can. But like I said earlier, we'll work with Lisa and your team to get answers back to everybody who submitted a question. So one of the first areas I'd like to ask you on is kind of a huge issue for our real estate community. What will you do regarding the SALT deduction, and what are your thoughts on SALT?
Well, eliminating the SALT deduction was one of the worst things the Trump administration did to New York, and it was hateful and harmful. And unfortunately, we've been fighting to get that put back in since. So Senator Schumer and I are committed to trying to make this a huge piece of COVID-4. It's really hurt larger states. It's hurt New York. It's hurt New Jersey. It's hurt California. It's really hurt our middle class. A county like Westchester is decimated if you don't have your state and local deduction. So it's been a real drag on the economy. So I'm making a priority to try to get that in COVID-4 as one of our biggest requests and requirements for the next bill.
Great, thank you, Senator. We also have obviously a lot of heroes in our region. Our healthcare providers are doing amazing work, our first responders. Can you tell us a little bit about the Heroes Fund initiative and your support of it?
So, this is like a war. We are at war with COVID-19, and we have our frontline. Our frontline workers right now are nurses and doctors, EMTs, healthcare providers, healthcare personnel, grocery store clerks, food processors, farmers, people who work in pharmacies. And these workers don't, some of them, I think all of them, don't have enough personal protective equipment. Our nurses certainly don't. And people who work in a grocery store may not have a shield. They may not have a face shield. They may not have a mask. Same with pharmacies. So the truth is, we should be paying them more. And in the same way we give our troops in a real war battle pay, I would like to create this heroes fund to give them time and a half, to give them higher compensation, because they are bothering to show up to work every day at grave risk to themselves, their loved ones, and they really are sacrificing every day just to meet our needs. And some of these frontline workers are among the lowest paid workers. So a grocery store clerk does not make a lot of money. And so he or she should be able to get more money because they are showing up to work so we can feed our families.
Well, following up on that, Senator, what is your thought about child care centers being open to allow to serve children of our essential workers? Any thoughts on that?
Yeah, so we put some money in the CARES bill, COVID-3, to have child care centers open for essential workers. We put, I think, $3.5 billion in for that specifically. And I think it's important that we recognize that these are families, these are moms and dads too. And if they can't be home homeschooling their kid like every other parent has to be, they need access to childcare. And so we have money in the last bill to keep them open. But one of the things that I tried to get in since the first bill was universal family medical leave, paid family medical leave. If we had had paid leave, we would have had a vehicle by which no one would have to lose their job. Anyone whose child stayed home or got sick or had a loved one who's sick would be able to access paid leave and be able to be home for 3 months. That would have solved the problem, and the federal government could have directly funded that leave. So it would have been a simple vehicle that would have actually made the difference in this epidemic. Now people are having to file unemployment insurance. They have to lose their, probably many of them, if they are laid off or fired permanently, may lose their health insurance. If you were able to just take paid leave and be able to keep your job, keep your insurance, and not lose your spot, and then just go back to work when this epidemic's over, it would have been a lot easier for the business community. So frankly, one of the biggest challenges we have not addressed is having national paid leave. We're the only industrialized country in the world that doesn't have it, and it's so disgraceful that we don't, and it's not a lot of money. National paid leave would cost each employee $2 a week on average, and it would cost each employer $2 a week on average. That's the cost of a cup of coffee a week. I think we can afford that for our workers, and it's not a lot. It's $104 a year per employee. Every employer can afford that, even a mom and pop with 4 employees. And it just is the infrastructure we're lacking. So we're hoping we can get paid leave put into the 4th bill as a structural change that the federal government will pay for at least the first year or two, and then it will transfer over time to an earned benefit, just like Social Security, where you buy in across your lifetime and your employer matches it. And again, if it's national, it's a small amount of money.
Senator, the Hudson Valley obviously has a strong history of family farms. Areas like the onion farmers, for instance, in the Black Dirt region, are struggling. Could you give us a status update on the Relief for America's Small Farmers Act?
So I serve on the Ag Committee, and I was the first senator from New York on the Ag Committee, I think in 40 years. It's been a really important role for me because we have so many farmers in New York State. We are the #3 producer of dairy in the country. We are, I think, top 2 for organics. We are huge fruit and vegetable producers. So what we've been trying to do is, one, the small farms are eligible under the SBA program to get loans that can turn into grants if they retain their employees. A lot of our farmers have been having trouble most recently because they don't have access to their workers through visas, because President Trump shut down all immigration. And I know he's made an exception for farm workers, but it's still very hard, and they're not getting here, and it's been very hard for our farmers to get the workforce they need. So we want to add more money for job training. And what I've encouraged our farmers to do is train some unemployed workers right now and just get the training done. So if your workers can't come from whatever country they typically come from, you can get local workers who are unemployed now. Typically, people don't choose farming as their profession. And so it'll be hard to get local workers to do it. But again, with this high unemployment rate, I think we might have a better chance. It's hard. Our dairy farms, our cows need to be milked every day. We have planting seasons coming up and harvesting seasons coming up. So we need our farm workers. So they're eligible for the SBA money. And if they have trouble, they can just call my office and we'll help them apply. If there's problems with the SBA requirements, they should let us know. And then if you're a big farm, which I know we don't have anybody over 500,000 employees, so let's say 500 employees. Yeah, maybe a couple farms that have that many, but most will be under SBA.
Great, thanks, Senator. Our municipalities are obviously going to be hit hard.
I forgot one thing to say. I do have a bill that we want to put in COVID for small farms that have debt. So this bill is one that says if you have up to $250,000 in debt, your debt can be eliminated automatically as a one-time elimination. We also have a second bill we're trying to get in COVID for rural areas. So if you are a community that is not eligible for CDBG grants because you're too small, if you're a town like the town of Larchmont would not be eligible for CDBG grants, you would be eligible for money under this rural act that I've written. It would provide $50 billion just for rural and small towns to access, since they weren't eligible for the state and local money, largely.
Great, thank you, Senator. So just coming back to our municipality question, will there be additional funds to help out our municipalities as we go forward?
So we hope so. The 150 billion we passed in the first tranche was in COVID-3. That went to bigger cities and it went to counties. And so Westchester County would have received the money, but if it didn't get to local municipalities because they're too small, that's the bill I'm talking about, this rural component. Like, for example, I used Larchmont. Larchmont would be eligible to get money directly from this rural lending facility. It's actually not lending, it's grants, straight up grants. And so they would then be able to. So we're hoping, and Senator Schumer is trying very hard to get this as part of COVID-4. So I'm hopeful it does, so that smaller municipalities can get money.
There's definitely a concern that that we need to have the right type of representation in Washington with the census, with the 2020 census taking place now in the midst of the crisis. Should the census be extended?
Yeah, it has been extended. The census has been extended to October 31st. It's really important that you fill it out. The census determines how much money we get from the federal government. So everyone must fill out the census form. Please urge every family member, every community member you know, every employee you have to do the census. Every formula for Medicare, Medicaid, education, anything we get by formula into our state, it's dependent on how many people we have. So if we are undercounted, we won't get our fair share. So please fill out your census form.
Senator, obviously we're having a huge problem with manufacturing. The crisis came out of China. It seems that we have to go to China to get a lot of the materials to help us fight the virus. What initiatives do you have in place, or you're looking at to build a domestic supply chain and restore manufacturing back to the United States, but specifically back to the Hudson Valley?
So one of the bills I've been working on for a long time is at the End Outsourcing Act. I mean, there's still tax provisions that let a business deduct if they send their business overseas for shipping, like ridiculous things. So we want to end any benefit that goes to a company that outsources. and we want to claw it back. So if you've taken a bunch of tax breaks and tax deductions over 2 years, we want to be able to claw back that tax benefit you received, because you're not helping America's economy. You're sending the business overseas. You're not helping American workers. So we really want to incentivize businesses to stay here and to tell them, if you're not going to be part of the team, then you're not going to get the benefit of tax breaks. And so that bill would be very helpful, I think, in urging people to keep their businesses here. But to be honest, we've seen some really bright lights out of New York during this pandemic, where they've turned on a dime to make the things we need. Different manufacturers making masks and gowns and other PPE, manufacturing, helping us with ventilators. We had a bunch of distilleries that said, we can make hand sanitizer. And so they started making hand sanitizer. So it was pretty great how responsive New York manufacturers have been. And I wasn't surprised, because the one thing about New York manufacturers, we can make anything and we're good at it. So we want to see more made in America. We want to see it in New York State, and we want to see it in Westchester.
Thanks, Senator. And I'll put a quick plug in for Access Supports for Living, which is partnered with the Warwick Winery and Distillery and Prohibition Distillery to create hand sanitizer for our nonprofits and healthcare providers. And that's happening right now in the Hudson Valley. So thanks for talking about that. Speaking about nonprofits, a number of nonprofits with employers over 500 were cut out in the first round. Do you see additional support coming for our nonprofit sector?
Yes, there is money. Not-for-profits are eligible under the SBA loan facility. They are absolutely eligible. The way it was written in 3.0, though, it eliminated not-for-profits that had over 500 employees. So they would have to then go under the big businesses loan facility. So I'm trying to get the not-for-profit provisions placed under the SBA rules, because we don't want to have to do loans. We want to do grants, because the not-for-profits are the ones that are working. So we're trying to get money specifically for the larger not-for-profits too. We were also hoping that we could get basically a provision. So right now, under the small business bill, you could get access to, if you were a franchise, so a huge business, but lots of small franchises, they were allowed to be categorized under small business. That's the same for not-for-profits. So you've got big not-for-profits like United Way, or Planned Parenthood, or any type of not-for-profit around the country, and then they have small entities that work under an umbrella, and those small entities are locally managed. We want them to be considered to be the same as franchises.
Our hospitality sector is obviously getting hit very hard, and a lot of our partners have applied and received, or are in the process of receiving funding for, with the PPP. One of their questions that they've submitted, and their concern is that that if they're not able to open during this 8-week period of time, how does that impact their ability to pay back that loan? So if they receive the money, the clock starts, but if we're still closed, how is that going to impact them with that program?
So this is a problem with the way it was written. So for example, think of a restaurant. If a restaurant can't reopen in June, which is likely going to be the case, they can't hire their employees back. So it's as if they're ineligible for the grant. And so it's a flaw in the writing. And I think we should be able in COVID-4 perhaps to correct that, and to get it so that anybody can have a longer timeline. We'd like the timeline actually to be 2 years long. So within 2 years, you could get your money. You could have that turned into a grant if you back up and running. Because I think it's going to take much longer than we thought. And so I just think it was a flaw in the writing, and that we should hopefully be able to, through consensus, fix, since some businesses just won't be able to reopen in June. Like, I don't think even small, like, let's just say gyms or yoga studios or restaurants, like those are the ones that I just don't know if their business model is even going to work for a while until we have real vaccines, and a vaccine's a year away. So it's harder than I think people estimated when they wrote the bill. So I think it's going to have a longer timeline to actually work. And I'm going to advocate for that.
That's great. That's obviously a huge concern in the region. Our healthcare system has obviously done an unbelievable job. And where do you stand, and where's the chance for getting additional funding to directly help our healthcare system?
Oh, hi. I think we'll have money for the hospitals in every bill, because we're watching them save lives every day, and we're watching their innovation make the difference. A lot of our hospitals are the ones that are figuring out what is the best protocol to save people's lives. How does this virus actually affect the body? They're figuring it out, and they are going to figure out how to overcome it. And so I think there's a great deal of consensus, bipartisan consensus, that we have to keep funding our hospitals and our healthcare system. I want to create this health corps, a health force, so that they can actually support our doctors, nurses, EMTs, and first responders to start doing the testing and the contact tracing, and then to do vaccinations. We're going to need 1 million of these workers, and that's a way to deal with the massive unemployment. It's also a way to shore up our healthcare system, which has been unfortunately bleeding workers for a long time. We've had a nursing shortage in New York State in the last couple of years, and we continue to have shortages.
Senator, just one more question, and I appreciate your time. Obviously we're dealing with the immediate effects of the virus right now, but what is your thoughts on long-term investments in infrastructure and broadband? What are the things that we need to be looking at in the Hudson Valley and nationally to really get our economy back on track?
For the Hudson Valley and for all of New York, frankly, we need more help with rebuilding basic infrastructure, roads, bridges, sewers. We need high-speed rail. We need rural broadband. Rural broadband is still an issue in many places in the Hudson Valley. Remoter areas, mountain towns, they don't get access. Providers don't want to pay for the last mile. They can't make enough money. So I believe broadband should be a right. It should be absolutely necessary for any community to have, just like water, just like phone service, it's the same. And so I'm hopeful that we can get money in COVID-4 for, I would like $1 trillion infrastructure investment across the whole country. We will need money to get people back to work. And so similar to the health force that we want to have, I want to have public service available for people who want to work in the green space, who want to do biofuels, solar, wind, geothermal, any type of renewable or efficiency technology. We need young workers to pick those careers, and we should fund it. That can be part of our infrastructure investment. So addressing global climate change at the same time as job loss, at the same time as training. So we want job training, and we want people who are unemployed or underemployed to be trained into these fields and pay for it. So I think we should do a massive infrastructure investment in COVID-4. And I think, again, that should be bipartisan. President Trump has said many times that he wants infrastructure. It's a nonpartisan thing, to be perfectly honest. So I hope there's no impediment to getting a real infrastructure bill put in the next package.
Senator, again, thank you so much for your time this morning. You provided great information to our business community. We'll continue to work with your staff to get answers to the remaining questions that we weren't able to answer today. And again, thank you for your time, and I appreciate you joining us.
It's my pleasure. And I just want to thank everyone for their work. The Hudson Valley is such an important part of New York's economy, and we have manufacturers, we have farmers, we have rural areas, we have small towns, and all of those are essential that they recover too. And so I'm trying to make sure that your voices are heard, and that the issues that we talked about today will be encompassed in the next piece of legislation. And just know that my office stands ready to serve, and Lisa is on the phone. So Lisa, if you want to give people your number after this and your contact information, that would be great. And Mike, you can send it around to all our participants.
Of course. Okay. Thanks again, everybody.
Thank you. Take care.